As we age, our bodies undergo countless changes, many of which are a natural part of the aging process. However, when it comes to heart health, vigilance becomes especially important. Cardiovascular diseases remain one of the leading causes of illness and mortality among older adults worldwide. Recognizing the early warning signs can make all the difference, allowing timely intervention and potentially saving lives. Let's explore the crucial warning signs of heart problems that older adults should never ignore. First, it's essential to understand that heart disease does not always announce itself with dramatic symptoms. In many cases, the early signs are subtle, easily mistaken for less serious issues, or even attributed to aging itself. That's why awareness is key. One of the most common and well-known warning signs is chest discomfort. This may not always present as severe pain. It could be a feeling of pressure, tightness, fullness, or squeezing in the chest. The discomfort may last for several minutes, come and go, or even radiate to other parts of the body, such as the arms, back, neck, jaw, or stomach. If you or an elderly loved one experiences any unexplained chest discomfort, it's crucial not to dismiss it. Shortness of breath is another significant red flag. While it's normal to feel a little winded after strenuous activity, unexplained shortness of breath during routine tasks, such as walking to the mailbox, climbing stairs, or even while resting, can signal underlying heart trouble. Sometimes, this symptom may occur with or without chest pain, and it can be an early indicator of heart failure or other cardiovascular issues. Fatigue is a symptom that is often overlooked, especially among seniors who may attribute it to simply getting older. However, persistent, unexplained fatigue, especially if it is sudden or significantly worse than usual, can be a sign that the heart is struggling to pump blood efficiently. If you notice that everyday activities leave you unusually tired, or if you find yourself needing to rest more frequently than before, it's important to consult a healthcare professional. Dizziness or lightheadedness should also be taken seriously. Occasional dizziness can result from dehydration or standing up too quickly, but persistent or recurrent episodes may indicate that the heart is not delivering enough blood to the brain. In severe cases, this can lead to fainting, which is a clear sign that something is amiss and requires immediate medical attention. Swelling in the lower extremities, such as the feet, ankles, or legs, can also be a warning sign of heart problems. When the heart is not pumping effectively, fluid can accumulate in the body's tissues, leading to swelling, also known as edema. This symptom may be accompanied by weight gain or a feeling of heaviness in the legs. If you notice swelling that is persistent or worsening, it's important to seek medical advice. Another warning sign is persistent coughing or wheezing, especially if it produces white or pink, blood-tinged mucus. This can be a symptom of heart failure, as fluid may build up in the lungs when the heart is not functioning properly. If you notice a chronic cough that does not improve with typical remedies, it's important to get it evaluated by a healthcare provider. Nausea, indigestion, or stomach pain can sometimes be mistaken for gastrointestinal issues, but they may also signal heart trouble, particularly in older adults and women. If these symptoms occur suddenly and are accompanied by other warning signs, such as chest discomfort, shortness of breath, or sweating, they should be taken seriously. Irregular heartbeat or arrhythmia is another symptom that should not be ignored. While it's normal for the heart to beat faster during exercise or stress, an irregular heart rhythm at rest, especially if it is accompanied by palpitations, chest discomfort, or shortness of breath may indicate an underlying heart condition. Some arrhythmias can increase the risk of stroke or heart failure, particularly in older adults. Speaking of sweating, excessive or unexplained sweating, particularly cold sweats, can be a sign of heart problems. While it's normal to sweat during physical activity or in hot weather, sweating without a clear cause, especially when accompanied by other symptoms, may indicate a heart attack or other cardiac event. Pain or discomfort in other parts of the body, such as the arms, back, neck, jaw, or stomach, can also be related to heart issues. This pain may come and go, and it may not always be severe. For example, some people experience pain that radiates down the left arm, while others may feel discomfort in the upper back or jaw. These symptoms are particularly important to recognize in older adults, as they may not always present with classic chest pain. It's also important to pay attention to subtle changes in overall well-being. For example, a sudden decline in physical ability, confusion, or difficulty concentrating can sometimes be linked to reduced blood flow from heart problems. If you or a loved one experiences these changes, especially in combination with other symptoms, it's wise to seek medical evaluation. In addition to recognizing these symptoms, it's important for older adults to be aware of their risk factors for heart disease. These include high blood pressure, high cholesterol, diabetes, smoking, obesity, a sedentary lifestyle, and a family history of heart disease. Regular checkups and open communication with healthcare providers can help manage these risk factors and catch problems early. If any of these warning signs appear, especially if they are sudden, severe, or occur together, it's essential to seek medical help immediately. Time is critical when dealing with heart issues, and prompt treatment can prevent complications and save lives. Finally, maintaining a heart-healthy lifestyle is the best way to prevent and manage cardiovascular disease. This includes eating a balanced diet rich in fruits, vegetables, whole grains, and lean proteins, engaging in regular physical activity appropriate for your abilities, managing stress, avoiding tobacco, limiting alcohol, and keeping chronic conditions like diabetes and high blood pressure under control. In summary, heart disease in older adults often presents with subtle, easily overlooked symptoms. By staying informed and attentive to the warning signs, such as chest discomfort, shortness of breath, fatigue, dizziness, swelling, irregular heartbeat, persistent coughing, nausea, unexplained sweating, and pain in other areas, you can take proactive steps to protect your heart health. Never hesitate to consult a healthcare professional if you notice any unusual symptoms. Early detection and intervention are the keys to living a longer, healthier, and more active life.